Alright, hey, I'm Austin Files, and my opponent's claim was that universal health care would be beneficial to all Californians, and their supporting points were universal health care would reduce overall medical costs for Californians, universal health care would provide a more stable system, and her last supporting point was illegal immigrants would be forced to pay for their health care. But I'm here today to refute those points. So my claim will be the opposite, which is universal health care would not be beneficial to Californians. The claims that I will be using today will be universal health care. It will lower medical costs, but also have a consequence and increase taxes. Universal health care will provide a less stable healthcare system. And lastly, universal health care will not get illegal immigrants to pay for health care. Alright, my first point that universal health care would lower medical costs but increase taxes is my opponent gave a clear definition of what universal health care is. And that is, it's a system where it provides an organized health coverage to all citizens of a governed region and that is publicly funded through taxes. The major problem with this is that it's funded through taxes. To be able to fund this, there's only one way that they can do it is by taxing us more, and our taxes would increase significantly, and I'm pretty sure no one wants to pay more taxes. I mean, we already complained about Obamacare being already had enough taxes to us, so this would just be even worse. But my opponent also stated that that you will no longer have to pay for overpriced insurance companies. Well, with now the Affordable Care Act of 2010, also known as Obamacare, it kind of takes that out of the question already. Obamacare basically just it makes an affordable insurance for everyone, whether you have a low-income job or whatever. It just makes it affordable to you. And with Obamacare, there's really no need for universal health care. So yeah. And then my second point, that universal health care would provide us with a less stable healthcare system. First off, my opponent stated that there's other countries such as like the UK and Australia that have universal health care. But the problem with those systems is that they're just a huge failing mess. Anthony Brown, an expert in healthcare in the UK, he put it like this: each year, thousands of British people, the young, the old, the rich, the poor, die unnecessarily from the lack of diagnosis, the lack of treatment, and the lack of drugs. They die and suffer unnecessarily to different reasons, but there's just one root cause: the blind faith that the government has in the ideology of a national health service, and the unwillingness to accept that it just doesn't work. So basically, it's a fail. Like, there's way too many problems within the system. They're funding all their money and just to get by, and that's another problem because they can't even afford money for medicinal research, and they rely on countries like the United States or France for those research for medicine because they can't afford for that. And lastly, a universal healthcare system would not get illegal immigrants to pay for their healthcare. The problem why is because emergency departments are mandated by law to provide healthcare for anyone who comes through their doors. So realistically, regardless of if we're paying for universal healthcare or Obamacare or whatever, any kind of healthcare system, as long as illegal immigrants show up, they can't turn them down. And no matter what, our tax-paying dollars are going to be going towards their healthcare. So there's really no way in stopping that unless we turn them down, and that's not an issue of universal healthcare or anything along those lines. So in conclusion, to wrap everything up, universal healthcare will not be beneficial to Californians because it'll only cause higher taxes, and it will actually provide a less stable healthcare system. And lastly, it will not get illegal immigrants to pay for their healthcare. Thank you.
All right, the structure is labeled and outlined very clearly. You then present a counter structure that responds to those points, which is okay, and I think the preview of that is all right. On your first point, you have a summary of what the public health care system consists of, but your main argument here is it should be phrased a little bit more simply. There's a trade-off. Whatever we save in healthcare costs would be taken away from us in taxes, and I think that that's maybe a good way to express that idea. You basically focus on the tax issue, which is fine, except that there's no evidence to show how substantial the tax increase would be, that it would be enough that it would overwhelm or take out of consideration how much we're spending on healthcare. Estimates, for instance, about some of the Obamacare policies run as high as $20,000 a year per family of four. If we were having to pay for that using taxes in order to pay for it, think how much extra money that's going to be. That's a lot of cash that's coming out of people's pockets that they're going to have to pay for. And I think you need to have some evidence on that. I don't doubt that there's a tax issue, but the question is it sufficient to trade off? And I think you need to develop that argument a little bit more. Your second argument, I think, is a little bit more direct. The advocate introduced an issue that allows you to make those comparisons because they say that it's been successful in other places, and they use some of those places as illustrations, which invites you to make the argument about whether or not they are effective in those places. And I thought you had a good generic piece of evidence about the UK and all of the thousands of people who die because of the way universal health care works there. It's not very precise, but in a short argument, a general argument like that, I think is pretty good. One of the things that you do want to do is contrast that to the advocate's evidence. What evidence did the advocate use on that particular point to show that it would have this benefit? And then you could say, well, here's how my evidence compares on that particular point, and that's why you ought to believe my conclusion. That's one of the things that's missing, I think, from your argument, is much of a contrast between the arguments that the advocate presented and the ones you're presenting. There's almost no analysis of the advocate's evidence or reasoning, just the outline of the claims, and so you're relying on counterclaims to take all of those arguments out. And if you've got a good counterclaim, that helps, but I think you're putting all of your eggs in a single basket here, and you want to be careful about that. On the illegal immigration issue, or the illegal immigrant issue, I think that this is another place where you need to contrast your argument, especially with the advocate's argument, because you don't have any evidence. If the advocate didn't have any evidence, then I think your reasoning challenge here is pretty solid. If, on the other hand, the advocate had some information that would explain why illegal immigrants wouldn't be a financial burden after this, and you only have this explanation about how things work currently, I think that there is a legitimate argument from the advocate to say, well, you're talking about a completely different situation as opposed to what we have when we have universal health care. As it is, I think that you've got a good general challenge on this, and I thought the reasoning made a lot of sense. All right, thank you.